Okay, so I'll just kick off to introduce myself. My name's Jo Dean, and I'm the team leader of integrated care at the Primary Health Network. Within our team, we predominantly look after allied health projects. But before we kick off, I'd just like to acknowledge that we are on traditional lands and to honour the custodians of the traditional lands that we all live and work on, and pay respects to elders past, present, and extend that respect to any First Nations people here tonight. And also just to express gratitude for the First Nations people who've been caring for the lands that we all live on for thousands of years. Okay, pop to the next slide. So tonight we've got a small group in the partnership. So there will be a couple of people still to join us. So I just thought we might start with a bit of an overview and then we might do some introductions. So tonight we're just going to talk about why we're here, what's in the Digital Essentials project for allied health, and how can the PHN help on your digital journey. Give you a bit of a walkthrough the Digital Essentials project so you know what to expect, and then wind up with the next steps. So being a small group, please feel free to just come off mute and ask questions at any time. But if you're just listening and not speaking, if you don't mind keeping your mute button on, that would be amazing. Yeah. No worries. Okay, so we might just go around and do introductions. So I might get everyone to introduce themselves. I think I've already introduced myself, so I might hand over to Peter, if you can.
Yeah, hi everyone. My name is Peter Mullen. I'm a Digital Health Officer with the PHN. And I'll probably cover a little bit more about me and the team shortly.
Okay, and then we've also got Kate, who will be talking to you later tonight.
Hi team, my name's Kate King. I'm a change and engagement specialist. Really happy to be working with PHN and very excited about working with the partnerships as well. My job will be to help you develop your digital journey and to support you through digital improvements throughout this project. So thanks for having me on board.
We're also very lucky tonight to have Maz with us, so I'll let her introduce herself.
Thanks, Jo. Hi, everyone. I'm Marilyn Dixon, or Maz as everybody calls me. I'm the manager for the digital health team at the PHN. And I do have a clinical background as a registered nurse, and I also have some qualifications in change management. So this is a fantastic opportunity to support and for our team to support allied health across the region, and to start embedding those digital workflows in practice. It's very exciting to see this come to fruition. Thanks for having me along tonight.
Okay, so we might hand over to participants. If you just want to maybe introduce yourself, tell us a bit about your practice, where you're located, and why you're sort of interested in the partnership, what drew you to it. That'd be great. Do you want to kick off, Michael, please?
Sure, yep. I'm Michael Vandergraaf. I'm in a physiotherapy practice in Tamworth. Been in practice for 24 years. And yeah, I'm no at my age, I'm no good with IT stuff particularly. So it's nice to know that we can be supported in that and helped to, I'm not sure what the thing involves, but I guess to know what's out there and hopefully make some good improvements. So, yep.
Great. Thanks, Michael. Welcome, Amy. We've just started off with a acknowledgement to country and just doing introductions. So do you want to just introduce yourself since I've got you on the limelight?
I can. Can you hear me?
Yes.
Okay, great. So my name's Amy Hanson. I run a business called Pelvic Form Physiotherapy in Port Stephens. So my focus is on pelvic floor health, and I have lovely Jodie who assists me. And yeah, I'm really excited about this.
Great. And Jodie, do you want to introduce yourself?
So as Amy said, I work with Amy in Port Stephens, and I feel very privileged to support what she does because I think what she does is absolutely amazing. and we're just excited to be hopefully learning and improving, and that's part of why we're here.
Great, excellent. So I'll just let you know the people that haven't been able to make it. Unfortunately, Debbie from Life Skills for Kids in Taree is quite unwell tonight, so she won't be able to make it this evening. New England Physio in Armidale. Both of the key people are overseas at the moment, so we knew they wouldn't be able to make it. And we also have Innovate Pain Management, a psychologist specialist who also have other multi-health, allied health disciplines. They're based in Broadmeadow. So that will make up the whole 6 practices that are within this group. So sometimes people are going to be able to make it to these sessions and sometimes they're not. So we will record them all so you can watch it at a time that's convenient for you. I suppose the advantage of being coming, if you can make it and it works for you, is being able to ask questions and build relationships with the other people involved in the project. So, okay, so I think that's it there. So we might move to the next slide, Kate, and just have a bit of a chat about why we're here. So I'm not sure how much people know about the Primary Health Network, but there are 13 PHNs across Australia. So our PHN covers the Hunter, New England and Central Coast area. So we're one of the largest regions. The predominant role of PHNs is actually to commission services and fill the health gaps within our local areas, so we can actually refine services to suit the needs of the actual region. But also we play a pivotal role in supporting clinicians in the primary health care space, and we also in the integrated care team and across the organisation build relationships with LHDs and other key partners in the health sector to ensure good collaboration and coordination and integration between hospital and primary care transitions as well. So we might go to the next slide. So at the PHNs have generally been quite GP-centric in the past, but the focus for allied health is actually coming into the forefront. Our PHN has had an allied health strategy for the last 4 years and is actually leading the national PHN framework for allied health, which is an engagement framework. And at the moment, that team is a collaboration of different PHNs across Australia who are building a toolkit for how PHNs should collaborate with allied health moving forward. That landscape's really changing. In 2001, we at our PHN put together a digital strategy to increase digital support. We have had various grants available and also to allied health in that period. And of course, you're aware that we did have a digital health maturity assessment for allied health, as well as GPs and residential aged care facilities. The allied health one was done in March 2023, of which all the practices involved in this project did participate in. And therefore were offered a place in the partnership. Here's Genevieve. I'll just let her in and let her introduce herself. Hi, Genevieve.
Yes, they've moved it. So.
Hi, Genevieve. Can you hear us?
Mm-hmm.
Turn the camera off. Are you there, Genevieve? Oh, hi. How are you going? We've just all introduced ourselves and done a bit of an introduction. So if, yeah, hi, you're on mute, sorry. We can't hear you, you're on mute.
God,
That's it.
this is why I need to do the technology thing. I'm Genevieve. I'm from Wee Waa. I'm hopeless. God,
I'm sure. There you go. Digital stress in action. Okay, Genevieve, we can hear you fine. So if you just maybe want to tell us about your practice and to the project.
Okay, I am a podiatrist and I am I'm not turning that off. It's just clicking off itself. So I'm really not that bad. Yes, private practice in Wee Waa, 2 days a week. Have been a podiatrist for 25 plus years. and just appreciate that the world is going digital and I need to keep up with it.
Great, thank you. Just so you know, we have recorded the start, but we haven't really done much. We're just starting to do a bit of an introduction about why we're here. So I'll just carry on with that. So we're just talking about now the Allied Health Digital Maturity Assessment, which was conducted in March 2023. So all the people involved in this partnership program completed it. We did have 80 practices in total complete the survey, and they were a really broad mix of professions. So it was a really great mix. Out of the survey, digital maturity level is calculated. So when looked at Allied Health, the average digital maturity score was 59.2. This is in comparison to GPs where the average was 71.4. So we acknowledge that GPs do get different support to Allied Health, which influences that, difference in maturity. But at the PHN, we want to engage in projects that can help, raise the digital maturity of allied health in the region. So this project has derived out of that thinking. So we might move to the next slide. This slide is probably best viewed if it was overlaid, and it's a bit of a comparison between allied health and general practice in the results. So there were 7 main areas that were analysed in the digital maturity assessment. So I suppose if you point out and look at infrastructure, allied health as a whole out of the 80 was sitting, right down here at about 40, where the with the general practices, they were more up around the 80 mark. Then we looked at meaningful use of data. So how we're using the data that we receive within practices. And again, with the meaningful use, this is about 60 for GPs, where in the allied health space, it was more around 40. So that just gives you a bit of an indication of some of the results that the survey looked at and some of the trigger points. And I suppose digital literacy infrastructure, patient readiness for digital adoption, and also the practice readiness and meaningful use of data are key areas that are focused. Okay, I'll just pause there. Has anyone got any questions about the digital maturity assessment so far? Feel free to just put out your hand or just take yourself off mute. Yeah, Amy?
I'm impressed with your graphs. Just that's impressive to me. So thank you for the work and effort. It's fantastic.
Great. Off to a good start. Right. I'll just move to the next slide and then
just before you do, Jo, Maz just had her hand up. Did you have something to add, Maz?
Oh, it was more just a comment, I guess, and I think it's really important comment. It's really important thing to highlight is that PHNs have been funded to work with general practice for about, since PHNs came about, and prior to that, Medicare locals, and prior to that, divisions of general practice. So the support has been there for a very, very long time. Whereas, I guess in the digital world, particularly in digital health at the PHN, allied health for us is a fairly new engagement space. So it's like, but what I love is that we've got really great willingness and willingness to engage and you're ready and hungry for this type of digital change, which is fantastic. So
covering it.
Thanks, Maz. Okay, the next slide. Okay, so out of the results, practices were put into different levels of maturity. So whether they're at foundational level, intermediate level, or advanced level. So these were just some of the comments that people said in the foundational level. They're worried about hackers and client information. They might be a solo practice and might be, more inclined to use paper notes or a combination of paper and digital. Where intermediate level, again, could be small or solo practices. And they feel like, only 1 or 2 people, we don't really have a need for digital. I just need, sort of an online billing thing, and that's all I really need. So that was sort of like a a sort of generalization, you know, sort of thinking, I suppose, in these categories. And Advance are always we're sort of more looking for ways to extend their business with digital and, you know, to optimize their business. So that is a very generalized, you know, sort of graph, but I suppose it's just a few comments that we thought sort of summarize what people were saying to us in these categories. Right, so next, please. Okay, so now we're just going to show a video of an allied health professional. We actually did a presentation last night, and he wasn't available tonight, so we've got it recorded. So I'm just going to play the video where he talks through some of the slides. So just bear with me. So Kate, I'll have to share my screen. I'll have to share it, including sound.
All yours. While you're just getting prepared, Joe, I'm just interested, guys, just a hands up. Did you receive your digital maturity assessment after you completed it? Do you have an idea of what your results were, whether you were foundation, intermediate, or advanced? It's okay if you don't. No, lovely. It's good for me to know that. It's something that we will work through and unpack as part of your assessment when we come out and see you as well. Okay. Thanks, Joe.
I'm going to play this video. Can you give me a thumbs up if you can hear the sound? Hopefully it works.
I will hand to you unless anybody wishes to turn their cameras off.
The bottom left of the screen is the little area where you can raise your hand if anyone has anything they'd like to add. Thanks for asking me to really outline sort of the view from a practitioner's point of view of what digital health might be going forward for allied health practices. Next slide, please. Jen, is useful. So a quick Google search of, you know, what is digital health, and you'll get a list of things similar to this. There are some specific things to Australia, but they're in my health record. But generally, people's experience of digital health is those kind of video calls that we all had to endure during the pandemic and lockdowns, where actually we saw digital technology in healthcare advance very quickly in a very short period of time. Lots of levers were pushed and pulled at government level to allow us to get further down the road than we would have been. The thing is that digital health is much more than just electronic consultation system. There's a lot more. There are different views of digital health, as whether it's a data-driven thing or a technology-driven thing. But really what this does is, if we can see the next slide, please, it presents us with a massive opportunity now. I mean, this is just like a dream, really. And if we could dream of the perfect system and what it might look like in a fully digitally enabled health system, we would have I mean, this is my own perspective, but let's say you've got a practice management system and a digitally enabled health service where perhaps you're going to receive a referral into your practice management software, and that comes electronically and securely from another allied health practitioner or from a GP or a specialist or a hospital discharge. And the client or patient, the consumer's record then is automatically populated with the information from the referral. Now, using that information in the referral, your practice management system may be able to automatically connect into My Health Record and download the health summary and any other information that's in there, such as the pathology, imaging reports, pharmacy, dispensations, all the information that if you've got a My Health record and you may have seen yourself, it could drag all that information into your practice management system. It can send out a link to your patient to make an online booking or your client, and also then a link to an online form for your client to complete their own personal information prior to them coming and meeting you for an appointment. And you might even have sort of some warnings highlighted in your system as well. And all this happens electronically, automatically, before you even meet the consumer, the health consumer, and yourself even, because it's not just for us as practitioners, this benefits consumers as well. And the next slide, please, Jenny. This next slide shows how there's a lot of health information out there in the varying forms. There's our personal information, so what we know about ourselves. Operational information is stuff like scheduling and billing and electronic medical records, which are held in these practice management systems that many of us have. There's diagnostic information out there, reports, tests, results, imaging, that sort of thing. There's therapeutic information. These may be e-scripts, treatment plans. There could be drug protocols or surgical procedures and records of them, or radiology, that sort of thing, which is kept separate once again from everything else. There's predictive data out there. Many of us have, smart watches, smart devices, phones that we carry around, and unless your privacy settings are up high, they're constantly monitoring your activity, even things like your heart rate, your pulse oximetry, and in some cases, they can be used to monitor vulnerable people who are in danger of perhaps of falls or wandering. I mean, probably the most common example that we see is in elite sports people, where the footy players all have those little GPS things on the back of their neck, on the back of their shirt, that monitors their activity and is predictive of injuries. And some very smart algorithms behind that can predict injuries in players before they happen, and they can pull them in and get them scanned and that kind of thing. So this is the sort of predictive technology which could link back in to our medical record if we allow it to happen. And then there's big data, the public information, the data that's out there, population health, Medicare, PBS stuff. The trouble with all this information is it's not interconnected. There's no interoperability, or very limited, between these different silos of information. Jenny, next slide, please. What we'd love to see, and this is the power, if you like, of digital health, is all this information connected and working together, making it universally accessible, so that we've got all the information when we're looking at improving our health outcomes. The next slide, please. Now, there is a national digital health strategy. There's a lot of money and political will, which has perhaps flown out the back end of the pandemic, where people realised the value of allied health services in primary health care. The first priority or first outcome that they're looking for is that health services are digitally enabled. And there are three aspects to this, that care is connected, and I've cherry-picked some of these. But allied health software integration with My Health Record is something that is underway, and national secure messaging and e-referrals. I'm not sure if you can read the rest of these things, but we want to connect everyone together. We want the workforce to be digitally ready, and we want to enhance, maintain modern and integrated digital solutions. So this is the National Digital Health Strategy, and this feeds very much into this program that the PHN is starting, so that we are ready for the changes that are coming. We're able to upskill, and we know how to make sure our systems are robust and secure. Plus, we're working on common terminology and interoperability standards. That's happening at sort of a pretty high level in the digital health world at the moment, and it's encouraging to see what sort of consultations going on there. Looks good for us. So the PHN Digital Essentials on the next slide, Jenny, is hopefully going to have us prepared for success, that we understand the requirements, and we can develop the right policies and strategies and make the right decisions about technology and what we want to get involved in, and be leaders in this change, because it's not just over the horizon. It's coming. It's not in the pipeline. It's on its way. It's very much, you know, it's the semi-trailer, it's the road train coming down towards you in the opposite direction, and eventually it's going to happen. It's going to appear. It's going to be here. So we need to be ready for that. The next slide will show how the Australian Digital Health Capability Framework is developed by the Australasian Institute of Digital Health. There's a QR code if you want to look at all of it. But the first aspect of that is digital professionalism. And yeah, the text was very small on this slide. We've tried to squash a bit in, but really it's about us committing to upskilling, to ensuring that we can comply with legislation, professional codes of conduct, policy, ethics, including privacy and security, that we understand the cultural, ethical and socio-economic aspects of access to digital health and the technology, and also making sure you have an online identity which maintains that professionalism. It reflects your position and standing in your profession, in your community, in your workplace or your business. So every time you're on social media and you're about to say something, be aware of your online professionalism. And my final slide is, Jenny, please, just about the leadership and advocacy aspects of the Digital Health Capability Framework, and how it's going to be up to us to lead these changes, because they are coming. We need to be ready for them, and hopefully be in a position that when our health consumers come to us with an expectation that we're involved, that we can be. Thanks everyone for listening to my ramblings of what's coming. Exciting times ahead, and I think that Peter, now I'm handing.
Just stop sharing there. So I didn't introduce, that's Damien Goff. He's a podiatrist that ran a very large podiatry business in the Central Coast for many years, and he's now moved to the Kimberleys. But he does a lot of amazing things in the digital space. So that was who was speaking there. So Kate, I might just hand back to you to bring the slide deck back up.
And I'm going to handball it straight to Peter Mullen, just because I can, Pete.
Thanks for that, Kate.
Pleasure.
Dear. Have we got the same slide deck as last night? Have we got our first slide there? We do. Excellent. Okay, so the first thing I get to do is introduce the team. Maz has joined us tonight, so Maz is obviously our manager. We're a fairly small team at the PHN in the digital health space. There's only the three of us. So there's myself, and then Jack Allison is also a digital health officer. My background a little bit, I live in the beautiful Port Stephens area. For Jodie and Amy, I'm sitting in Corlett. So there you go. So we're probably neighbours. Prior to joining the PHN, just coming up to 6 years ago, I managed a general practice up in Armidale, so I'm pretty familiar with the New England Northwest area as well. I grew up and lived in that area for quite a while. And what I've been doing for the last nearly 6 years, as I say, with the PHN is working with a whole range of stakeholders, general practices, allied health practices and specialist practices, and building their digital capability as well. So that's sort of, that's the area that I've been working in. Looking forward to supporting each of you through the process. It's quite an exciting journey, and there's a lot of work to cover, but it doesn't matter where you are, it's where we finish, I suppose, is the way to look at it. It's, you know, we're all in different stages, and that doesn't matter where you are. So, so looking forward to helping you with that. Might get you, there's a couple of links there that when the slide deck comes out, but I've put in the chat a link to our digital, the Healthy Together Digital Care Toolbox, which is a online resource that we've curated as the PHN. The link's in the chat there, but you'll get the links out to that. You'll see that there's a whole lot of tiles here. When you first go into that page and you scroll down, you'll see it'll say show resources for all audiences, but there's a filter there. You can drop that down, just click on the filter, drop it down, and you can actually filter it then to allied health professional. So that'll give you that information which is relevant to you as an allied health professional practice. There's a lot of information in there. What we do is not necessarily curate and develop a lot of the information ourselves. We'll probably lead you off to give you links to other websites and things like that. They're the main sources of truth, things like the Australian Digital Health Agency, Services Australia, and different websites provide a connect there. You can see to give you that information, because rather than us having to keep that information up to date, we rely on them to curate and look after their own information. You'll see there that, the other thing is we will be developing an allied health tile that's coming as well. So there'll be more information sitting in behind that as well. So part of what we will be doing is, and what we're recommending for you is, as we start on this journey, is to start to develop your own interaction with some of these tools. That first tile there is My Health, the My Health app, and that's a consumer app, so that's just something that we will be encouraging you to set up if you haven't already. Does anyone in the group, if I can quickly ask, if anyone wants to turn off their microphone, they've actually used their My Health app, if anyone's got it? No, heads shaking and things like that. Maz has, Joe has. Guess he did a presentation on a couple of months for our internal staff. But that's one of the things we'll be encouraging you to do, because it's about engaging with that space as well. It's a really good app to set up. It gives you that, you've got your own personal information there in your hand on your phone. And there's a really good, we'll give you links off to how to set that up. There's a really good video on the Digital Health Agency site that you can just follow it through, and we'll help you with that process as well. Also then encouraging you to set up, if you haven't already, access to My Health Record through your own practice for your patients or your clients. That's something we'll encourage you to start again on that journey fairly early on, because there can be a little bit of a process behind that, and at times you'll probably throw your hands in the air and say, what does this all mean? That's why we're here to help you and support you through that journey. There'll probably be terminology and things like that, but we'd encourage you to start that process as well. Things like setting up what they call a PROTA account, which is Provider Online Digital Access. Getting your policies in place, because they're the things that underpin how you interact with the My Health Record. So making sure we've got those policies in place, that your team is aware of what those policies are, so they know the ground rules as well. So I think that's really important. And it may be whether you, depending on the software that you use, you may interact with the My Health Record through, if you've got conformance software, you may be able to access directly into the My Health Record. Otherwise, we'll work with you to get you set up for what they call the National Provider Portal. And that's a way, again, where you can view information rather than sharing information, but you can actually access information there. One of the reasons, and I think Damien alluded to it, when he's in the video you saw there, one of the reasons we're doing this is the Digital Health Agency is actually working with a lot of the allied health software providers at the moment. They're building that capability to have that increase that number of conformant allied health softwares that has that My Health Record access. So that's coming, and that's being worked on in tandem with this project, if you like. We're not involved in it, but that's happening in the background as well. So that's another reason for getting that journey into the My Health Record started. There'll be a bit more information to come out in phase 2. I don't think I've got another slide. I think that's it, isn't it? If I remember rightly. Can't even remember if I've got 2 slides, but I might pause there and just ask again if there's any questions. More than happy to take any questions at this stage. Same as last night, stunned into silence.
All right. We go to the next slide then.
I'm busily downloading the My Health app while you're talking, Pete, because you sent it to me last night and I thought I'll give it a go tonight. It's actually quite easy to get into if you've got your MyGov access set up and bits and pieces. It's lovely to see what's already available in there.
Yep, it's a really good resource.
Yeah, we'll be encouraging everybody to jump in there as part of the roadshow and the activities that we've got planned to help you guys out as well. Sorry, Maz, I think I talked over the top of you then.
No. I was interrupting you. No, don't apologise. I was just going to say that's the hardest thing is the MyGov setup. And if anybody's ever tried to set up a MyGov account, you'll know that pain. but once you've gotten through that hurdle, then it's easy. It uses your phone's metrics to access like your Face ID and your thumbprint or password pin, whatever. So it's fantastic. It's a great little app.
Amazing. Jodie, did you want to share some news with us?
Well, I just wanted to say, whoops, oh, you can't see it. It's MyGov, My Health Gov, the app, is it?
Yep.
Perfect. I thought I might download it at the same time.
Very good.
Well done, Tick.
Top of the class.
Preaching to the converted.
Great.
Actually,
Thanks.
Kate, I should have also mentioned at the bottom of that digital health toolbox page is all our contact details as well. So if people do need to reach out to us, the bottom of that page, you'll have all our contact details.
Amazing. Thanks, Pete.
Okay, so now we're going to start a bit of a work through the what the Digital Essentials project is really all about. I suppose a little bit too about how it came about. We've had a very engaged Adelaide Health Reference Group at the PHM. We've been very fortunate to have 12 professionals from different professions to sort of guide our strategy, and they basically came to us and said, look, there's so much information out there. It's so overwhelming. We're so busy. We just need a simple checklist, a digital checklist to tell us what we need to do. And it needs to be easy, it needs to be accessible, and it needs to be relevant to allied health. So that's how the project sort of devised as well, as an output from the digital assessment. So that was all in the mindset when we were putting this together. So I think that's what we've sort of tried to do, and I think we've done quite well because there is a sea of information out there, and we've tried to narrow it down to save you having to search around for it and just bring in the relevant stuff into one simple place. So we'll turn to the next slide. Okay, so it is designed in a simple checklist style, and the format allows you to go through and select a digital plan that's suitable for your practice. So there's going to be elements within the project that you think, we already do that, we're on top of that, that's not really for us, but you know, there might be another section that you think, oh, that's for us. It'd be really great if this team member could, you know, sort of have a close look at that for me and blah, blah, blah. So, or we could talk about that in a team meeting. So as you go through, you know, it's designed to create an action plan where you can sort of implement digital change into your organisation. The project will be delivered in sort of two different streams. So the startup stream is now. So there are 13 activities in startup. For the partnership, we ask you to do the first 9 before we come out to your practice, ideally, if possible. And then the last 3, the last 4 activities we'll be doing with you in the practice during our practice visits. There are group support sessions that are scheduled monthly. And there's also some private practice checkups. And, you know, if you need to ask us questions individually and things like that, that will also be possible. So there'll be regular feedback opportunities as well to help you along the journey. If you want to move to the next slide. So this information will be delivered in what's called an LMS, which is a learning management system. And just for transparency's sake, it's the first time we have used a learning management system to deliver education. We feel like it's a good solution, but definitely we'd really value any feedback on how we can critique and improve it on it, as yes, it is our first time using it. So when developing the project and looking at the results of the assessment, we really wanted to try and achieve these key benefits from the project. So we're aiming to achieve availability of digital supports that are relevant and easy to use. We want to increase the adoption of digital recommendations that are given throughout the project. And a big one is reducing the risk of not meeting compliance requirements, especially when it comes to cybersecurity and privacy, with all the, keeping on top of the latest, hacks and things that can happen out there, and to really protect yourself and your important patient data. And obviously, a main goal is for us to advance the digital, but also the change management capabilities of allied health practices in our region to feel more comfortable with change and bringing people along for the ride. I think the action plan and implementation, it's all about the process, but the change management is all about the people, and they have to be engaged and come along for the ride. And that's where Kate comes in and is a really great, valuable source of information and a sounding board for that piece. From the PHN, really we're I suppose advantages for us and benefits for us in the project is really to build a scalable and well-informed allied health toolkit. We have had allied health input and digital input into the design of the toolkit, and they have tested it for us as well. But as we expose it to a greater cohort, we understand it can only get better, and then it's more useful to a wider range of people in our region. So that's also what we're hoping to receive a benefit of. And have a better understanding and connection with allied health in our region to really understand your local needs. So when we plan for the future for business and digital needs, we are more informed and can make better decisions about delivering support that really is relevant to you and what you need. So the next slide, please. This is a bit of a roadmap. It probably started a lot longer before August, the planning. So it's cut off all the fun bits at the start. But now we're really up to October, and we're up to this partnership induction phase here. So as you know, we've booked in practice visits, so we'll just go through those further on in the meeting. So they'll be happening towards to the end of October, and this is where you'll complete your phase 1 startup activities. Phase 2 of the project is more tailored activities where you can pick and choose which ones are relevant to your practice, and we'll guide you based on the assessment of which areas that you could we recommend you should focus on. We'll work together to get a tailored action plan that you agree to and that you're happy to implement, and we'll deliver that to you and work through that till you're happy with it in a session in November. And then we will release the tailored activities, and then we'll have regular monthly check-ins to see how you're going, see what support you need, and make a bit of accountability as well to sort of keep the motivation to, continue on the journey. The other part of the project is we're looking at delivering some tailored education and learning as part of the project. So we do have some topics in the evaluation that we've suggested could be topics you're interested in. Some do cross over outside digital, such as financial management or business planning and things like that. That's not actually within our remit, but we do offer, we have offered business skills training and advancement in the past, and we do have referral pathways to refer you into different areas as well, if it's something that we can't cover at the moment that you need. So if at the end of this session, we'll have a small evaluation survey, and it's just asking if we hosted, got an expert to speak on AI or digital marketing or cybersecurity, would you, be likely to attend that education? So we can work out what your preference is. So at the end of this session, if you fill out that evaluation, in particular that education piece is really important, so we can really get the speakers that you want to hear from and that you are interested in. in the digital space. That's it, Kate. Over to you. Has anyone got any questions for me? Feel free to ask. Kate's probably going to go into a bit more detail about exactly what we're going to do in the practice visits and when we're visiting. So I'll just hand over to her to go into that sort of detail.
No dramas. Feel free to interject anytime, friends. This is really all about you. We're here to give you the best support in your digital journey as possible. So if anything comes to mind, raise a hand, jump in. What I will do is I'll take you through a bit of a walk of what's in the LMS tonight, and particularly what's in these startup activities. Jo mentioned that there's 13 startup activities. We would love to see you progress through the first 9 before we come and visit you and do your assessment. What those 9 will do will give you a good baseline and a connection with the people that are on the screen with you tonight, so that if anything goes haywire, I always keep myself on mute. I can never find my camera. Just those simple things as you move through some of these key activities. We're here to help, and we want to give you the best foundation before we move into helping you develop a tailored action plan that suits your needs and has a good lens of strong change management and support so that you're successful. So I'm just going to swap screens. Just tell me if you can see the LMS come up on your screen. There's 2 boxes there. As Jo mentioned, this is a brand new product for PHN. In a sense, we're going to use your experience to help grow this for other allied health professionals and also other health professionals that the PHN support as time moves on, if the product works well. So honesty is king, my friends, as we move through these new advancements digitally for this company and ourselves. You'll see that there's 2 tiles on this service. Last night we mentioned we had another session, and that's where the recording that Damien did for us. We have set this program up for self-paced, self-service allied health professionals, and we've also set up this partnership service for yourselves. The self-service professionals have been given all of the tools that you will receive. However, they're on their own journey. For yourselves, we are here at your call to support you through the next several months to ensure that you get the right rigor around your digital advancement. And when we say digital advancement, I just want to confirm with you, it's not that we want you to have an advanced rating by the end of this. We want you to move through improvements that suit the business that you are at a time and a speed that works for you and your patients and the way that you operate. Any step through digitally is going to be a benefit for yourself, your patients, and your referral services, as well as your supporting services of the lovely PHN. So the LMS itself is a very simple product. You basically will receive links on Friday that will allow you to click through and start programs of work. You only need to click through on this one tile. I've already had a little look at it today, so it's telling me to resume the course, but it will actually ask me to start it when I'm here for the very first time. So I'm just going to restart and show you through it tonight. So it's, oh yes, I'm starting. There's some support information for stage 1. It'll talk about the 9 activities that we would like you to complete and reference to the 10 to 13 that we will help you with when we visit in October. And it will flow you through, and I'm just going to click through a couple of screens so you can just get a feel of the product tonight. It'll click through screens that will give you advice and additional support documentation. And as you move through each of the activities, here's a perfect one. Attend the induction session. Hello, friends. You've completed one of the activities. Well done. you can tick it off. We want you to be involved and engaged right from the beginning. For those that aren't online with us tonight, we will add the whole recording here of tonight's session, and we ask those people to just keep up to speed with the advice that we've provided you tonight. So you're already 1 activity down, 8 to go. The next one is telling your team about tonight. And if your team is big enough and it requires this, set up a little digital working group. If your team is a team of 1, you are the digital working group on the Digital Essentials project. Congratulations, you've finished activity 2. I'm just going to stop here. I'm just interested to know from Amy and Jody and Genevieve and Michael, what are the sizes of your practices? Is it of an advantage to create a little working group, or are you the working group? Amy, I might start with you. I'll just get you to jump off mute, my friend.
Ta-da! Yeah, it's my practice is I'm a sole physio. Jody is really my practice manager, and then I have another lady who assists at other times. You know?
Amazing.
Yeah.
Amazing.
So we are the team.
Fabulous. Have you got an idea that it will be you and Jody on the working group, or will you bring your other colleague into helping advance your digital capability?
I'm thinking it'll just be Jody and I.
Ah, very good. Oh, well, activity 2 is complete. Well done, friends.
Thank you.
Genevieve, what does your practice size look like, and what's your thoughts around having to provide updates or creating a group?
My practice is just me. I work in a medical centre with 3 doctors, pathology and everything, but really the business is just me. And I am happy to work with anyone, really.
Amazing, amazing. Well, that's lovely for us to know as we prepare to workshop with you as well. So thanks for the insights. Michael, how big is your practice?
Oh, it's only fairly small. There's me and 2 soon to be another as well, physiotherapists. So there's a few of us. And there's a full-time position out front, but it's manned by at the moment 3 different people who do the reception work. So but that's also going to change. Some of those are leaving. So but there's a new girl coming on, and it might be an idea to get her or the other girl who's going to be on the front staff to get involved. I'm just not sure. I guess that's what I've got to find out tonight, whether it's worth getting them on board straight away.
Yeah, absolutely. It sounds like you've got a bit of movement in the station. It'll be good to consider what's going to suit your journey as well. And if you need to bring some people in for part of the journey and others for other parts of the journey, that's okay as well. Whatever model you land on is fine by us.
Thank you.
No problems. So as you can see, the LMS is pretty easy. You can click through, you can receive links that will provide you support to other advice to complete this activity. As Joe mentioned before, we tried to keep this as simple and as a one-touch shop with current and relevant information to make this advancement as easy as possible for you. We all know you're busy people. Having a small business isn't always an easy ask to do your day job and then to do some additional improvements outside of office hours and, you know, on weekends. So we're trying to keep this as relevant as possible. As you can see there, I've landed on this page just to let you know that you've got this wonderful support network available to you. These are the people that are here tonight online that will provide help and assistance, and I will help you develop your digital activity plans and support you through advancing those during the project as well. There are a wealth of information in here, and I'm not going to go through all of it because I don't want to spoil all the surprises for you when you get the link later this week. But one of the other key components of this is that you can leave the LMS at any stage, and you can see here there's a percentage of where you're up to. It will take you directly back to where you finished off on. So if you can only start bits and pieces of it in a lunch break or first thing in the morning, or you've got 5 minutes because a patient is running late, whatever the case is, you can always jump back in here and pick up where you left off from. That's a really great advantage of this little product. And as we move through stage 1 and into stage 2, we will ask for feedback on your experience. If it works, what didn't work, what else you would like to see, just general experience advice. And we'll try and pick that up when we engage with you, whether it's at check-in points or engagements that we've got planned together throughout the project. Or program, as I should say. So another key support document that we have here, and I'm just going to resume and go back to the start again, just so I can show you where it is there are a number of editable templates in here for you to use. This one here is basically a progress management template for this stage, and it looks a little like this. It talks about each of the steps that you will find in the LMS, and it allows you to jump in here once you've downloaded it and pop in your progress notes just so you can keep track of where you're up to, what else you might need to think about, what else you might need support on, so that it's a relative document that you can get to the end and say, I've ticked off all 13 activities in the startup activities. Now, for the partnership program, we're not going to ask you to complete 10 through to 13. When we come out to your practice, we will actually support you directly with these key activities. So the 9 at the beginning are really ensuring that you understand why we're here, that you're connected to the right people, and that you're starting to hunt around into the digital resources that are available. The health toolbox that Peter walked you through, that's as easy as saving those links and taking a look at all of the activities that are available, information that's available on there. When we move into the back end, these 4, we will have pre-planned activities for you, and we'll make sure we cover those off in the 4-hour session when we arrive at your place. So that's the LMS in short. Any questions or queries from anybody about the product or about the key activities? No? All happy? Amy, sure thing.
So Jodie and I are like a team. If she does something, is there a separate link, or is it just the one link that we go in to do tick the boxes off, or are we meant to sit and do everything together? Just trying to work it.
It's a good question.
Yeah.
Jo, would you like to answer Amy's question?
Sure. I'll set you up with an individual login, so you can just work at your own pace. So it'll just, you know, if you start it and finish it, it'll come to where you're working, Amy, and then Jodie will have her own.
Okay. Login. Great. Thank you.
Beautiful. And you can certainly share this one management document. It's about your practice. So how you choose to build that digital maturity and the digital capability within your team. You might split some of the jobs and educate each other. You might choose to do them together. Jodie.
I have a question about if we create a group. I sort of assumed that if we do the activities, you have individual links in the group, but you can see how each other's progressed, or you can share things with. Is that how the group works?
The working group itself, is a benefit for medium to large organisations, so that you've got a good spread of support that would be able to uplift everybody in the organisation, so that you're helping prepare documentation or deliver training or support each other in knowledge that you've learnt digitally. For yourselves, you'll probably find a natural hum of how you operate as a business, a small business currently at the moment, where you're building on each other. There will be some components as we move through your tailored action plan, where, just as an example, Jody, you might need to do privacy awareness training, whereas Amy's already done it previously. So there may be a split in difference there, but we'll help you unpack that and decide what sort of path each practice needs to go down based on our evaluation and our support advice.
Thank you.
That's okay. No problems. Okay. If there's no other questions about the LMS, we will jump back to the presentation. As I mentioned, we will send out links to the LMS on Friday. We want to make sure we get this recording in there for those that couldn't attend tonight, and make sure we've got a good, strong setup task card for you to get into the LMS, set up your right passwords, and make sure that that service itself has been easy for you to start off. So I've mentioned the workshops a couple of times. Joe has been very proactive in contacting you all to arrange a bit of a road trip for Peter, Joe and I. We can't wait. We're going to get in the car together on the 21st and drive up to Taree to start off with. Unfortunately, Debbie can't be with us tonight, but I wouldn't mind those that are on online just to scan through the dates and the times that we have confirmed to ensure that they still work for you. We want to be able to visit and have 4 hours of your time to work through these key assessment activities with you. So if we need to make any alterations on any of these arrangements, please feel free to let us know. Because Pete, I'm sure your bags are already packed. I can't wait to take the road trip around to Tamworth and Armidale and to go and see Genevieve in Wee Waa. So over to you, friends. Have we got the right times and dates for your venue? We're good, Amy? Lovely. A thumbs up is fine. Michael, thank you so much. Genevieve, we're right to come on the 23rd of October. Fabulous.
Yeah, the only thing I was thinking, so Wee Waa is, I think you're staying in Narrabri on that night on the 23rd, and I've got a small treatment clinical room, and I'm just wondering if maybe there's like a space in Narrabri that you can rent rooms and office space. Like, I'm just wondering, it might not be worth you coming all the way to Wee Waa. I could meet you in Narrabri and we could maybe just stay at the Exchange if we're just doing, like if we need desks and chairs and all that sort of stuff. Does that make sense? Am I making sense?
Yes. Yep, absolutely. We can take that one on notice and have an offline discussion and make some arrangements with you that suit, if that's okay.
Yeah, that's fine.
Amazing.
Can I just confirm, Jenna, you're co-located with Dr. Siva, is that correct?
Yes, that's right.
Yep, cool. Yep, know the practice, been out there a few times.
Yeah, well, so, you know, my room's just a small treatment room, and then it's, you know, there's sort of all treatment rooms, but I just think sitting down, chatting, going through computers and things, I might be better just in a workspace. That's all. Yep.
All right. No, we can chat about that offline. That's no problem at all.
Great.
Lovely. Thanks for flagging that with us. Amy, Michael, Jody, your practice is okay for us to come and hang out with you for a block of time? Beautiful.
Yeah, I mean, that should be fine. How much do we need to access the front computer where all the patients are going to be coming in and out? Because the other physio will still be working on that day, but in that morning I'll be There's a room out the back here I am at the moment, which is plenty of space, which I assume we can just sit here and talk and do stuff. Is that right?
Yeah, absolutely. We will try to have as little impact on actual business operations as possible. We can always take actions to have a little look at particular infrastructure or information as par for course, so that we can let business just run with us in the background.
Yep. Yeah, that's what I thought. Yep.
Excellent. All right then. So I'm just going to give you a quick overview in regards to what we will cover off at the workshop itself. So we'll make sure that you're going okay in your startup activities in the LMS for phase 1. We'll do a health check and a completion support activity. So if, you know, life has gotten in the road or you've gotten stuck on something that you haven't been able to reach out for help before we come, we'll be able to support you there. Pete, we're going to cover off the My Health record for practices. Do you want to just give the team a bit of an overview on what we will do in that space?
I think it's going to be a little bit of, we'll have to probably work that one a little bit by ear at each practice, because it'll depend on what software they're using, if it does have that conformance level. I'll try and do some work on that beforehand and know that in advance. But I think that's what we'll be looking at. And we'll look at what the, what are the policies you'll need to put in place, because as I mentioned earlier, that's what underpins everything. So it's critical to get those things in place first. And then looking at how are you actually going to engage with the My Health record? So is it going to be through National Provider Portal? Is it through conformance software? If it's Provider Portal, what do we need to set you up? Do we need a Prater account? How do we get that set up? And then looking at how that's going to work within the practice as well, if there's multiple clinicians that are going to engage. So what's the framework that will work under and things like that. So we'll look at all those sorts of things. Introduction to some of those things. I mentioned setting up Prater accounts. We'll take you through, what's involved in that. Won't necessarily be able to do that on the day. Some of that can be a bit of a step-by-step process, but we'll take you through as much of that and work through that sort of stuff, and then give you an idea of what it's going to look like as well. So yeah, I think that, so it'll be a little bit, we'll have to work it on the day to see, depending on what we're looking at. So
fabulous. Just out of interest, does anybody have My Health record already set up for their practice? Not you and Amy, no. Michael or Genevieve?
No, I don't think so.
Okay. Oh, Michael, love that face. That's the fun face. We get to get right down into nuts and bolts with you. That will be a really great exercise for everybody to experience with Pete, and have that dedicated support to be able to move through that opportunity at your practice. The other component of what we will do on the day is we will actually roll our sleeves up and we'll look at where you are currently at with your digital journey, from patient referral or health professional referrals. I will facilitate pulling all of that wonderful information from you based on some key activities that we'll recommend in your tailored action plan. I'll support you through that with some fun activities. And we'll also, as I mentioned before, take any interest in your digital maturity assessment results from 2023 as well. And this will align with the optimal digital workflows. And Pete's going to walk you through that in a minute, just so that you can have a little look at a good baseline that we'll be working towards. But it'll depend on where you're at and what aspects of digital advancements you have already in your practice, or what you would like to achieve. So that's where the tailoring really does come in. The biggest question I have on my mind, though, is, are you lollies or cake? Because I need to know what I can bring for you. So if you're interested, pop in the chat, I am lollies, cake, or something else, because sometimes you're cheese and biscuits. Let me know what I can bring along, because it really is us spending a bit of time together, really understanding who you are and how I can then help develop your tailored action plan. The one of the key outcomes will be booking that hour and a half with you in the following weeks after we visit, so that I can come back and present recommendation on how you move through digital improvement, and how we can start you up on some of those key activities that are on those plans. Anybody got any questions about the workshop outline, what we're aiming to achieve with you? If it's frightening, scary, you don't want to be part of it anymore, or you can't wait for us to come?
I'm excited. I think it's, you know, I run a practice. It's really, really busy and I don't give much time to this at all. So yeah, thank you for the opportunity.
Amazing. Can't wait to get involved, Amy.
Yeah.
Lovely.
Kate,
Jodie's in.
There's a couple of messages in there about people feeling a bit nervous. So yeah, just wondering what you'd say to that.
I would say thank you for cheese and bickies and coffee, Peter Mullins. Love that. Look, change is nervous for everybody. I've been in the profession of change and engagement for at least 15 years now, and the one thing most people say to me is, "Oh, change. Oh no, I don't want to change. Oh no, it's too much. I'm nervous about what I'm going to have to experience or invest in time." The benefit here is your journey is going to be supported, and I will support you to develop a journey that is the right time, speed and vibe for who you are and what your practice is. It will be an experience that you can adopt and drive yourself post us being past this program of work. If you're nervous, and I need to slow down or I need to recalibrate how I deliver some of the assessment information, please feel free to tell me. I'm a really great chameleon to make you feel comfortable in this. And from my point of view, you're at the centre of what we're aiming to achieve for the benefit of you. So I will take guidance on how I can proactively drive that engagement to make you feel as comfortable as possible. What do you think, Michael and Genevieve? Is that a good approach? Thanks, Kate. Okay, excellent.
All good. You know, that's good. It's just I guess nervous about, because my knowledge in this area is not great, and so I think you know, it's just a bit foreign. Some of the stuff I know I don't know, but that's what I'm nervous about, I guess.
Yeah, absolutely. Often what I find, Michael, is when we move through digital transformation with small and large businesses, from a change point of view, a lot of the nervousness is around, I'm not sure how to get around this application. I'm not sure where I need to find the right information for me to be compliant. Or when I look at what makes me compliant, it's overwhelming. So we can work on some modelling that actually stages it or chunks it down in a way that makes it easier for you. The other great benefit is we've got Pete and Maz in the digital support team that will be able to help you with the products and services that the PHN recommend and support through their digital health toolbox. So we'll tap into them. We'll say, come and do some training or show us how to do this more easily. And I think the great advantage for allied health at this point in time, and you being the first partnership support, is that we'll learn from you in regards to ways that we can help other allied health professionals feel more confident and be able to advance digitally based on your experience. So we're really looking for you to tell us exactly what would that be to make that easier.
You're breaking up a bit there. Internet here is not working well or something.
Oh, I'm sorry
I might
about
move
that.
to another room. I don't know.
Shifting gears for better internet. I love that. Excellent. Look, I'm briefly going to hand over to Peter to walk you through the optimal digital workflow. It's been newly produced as part of this program of work, and it will underpin our key activities as we move through the program. Just before I do, Jodie, do you have your hand up? Would you like to ask anything, or is it from previously before?
It must have been from previously, I think. I don't know if I have to turn it off. There you go. But no, I only did it once and it was a previous question.
Beautiful. Thank you. Hey, over to you.
Cool. Okay. So what we've developed is an end-to-end, if you like, patient journey from start to finish. We've got 2 entry points, but we'll show you the whole journey here at the moment with the 2 entry points. The first is just obviously a referral for the patient coming in from either another allied health professional, specialist, or a GP, and then the other is where a patient might self-refer into your service. So I might get you to jump down to the bigger picture, Kate. Thank you very much. So we'll start off with that referred by another health professional. So again, the journey starts with them, with the patient booking through them, usually, through an online app or something like that with their GP or an allied health professional. They then attend that initial appointment with that allied health professional. It might be using conformant telehealth software, and it might be in person. Then the referral, that they will have a look at what that patient actually needs in regard to that journey. Now, it might be, if it's a GP, it might be using a GP chronic disease management plan, or a GPMP as they're known, and a team care arrangement. They were due to be ancient history by the 1st of November, but the government's come out in the last couple of weeks and said that's now going to be put off until July next year. So if you've been involved in team care arrangements or GPMPs in the past, that's here to stay for a little bit longer. But it might be, the referral might come through with one of those, or it could be a mental health care plan for someone who's working, in the mental health space. They would pull that information together. They might attach some bloods to it and things like that, or some imaging. And then it comes out of the referrer's clinical system through to you. We would hope that's coming to you via a secure method. That might be secure messaging, or it might be an e-referral program. And that's some of the things we'll look at when we come out and have a talk to you about what's available in that space, why you should be using that, why email is not the way to be going, and some of those things, and we'll work in what works best with your practice. So that message is then sent through to you. You receive that into your clinical system. Again, you then look at that. It's reviewed by the allied health professional. They will have a look at that. They might advise the referrer that they've received that information. In the case of a TCA or a team care arrangement, obviously you've got to confirm that you're willing to be part of that. So that might go back again using secure methods. Not email, not fax. I know that's part of what we'll look at again, if they are necessary evils sometimes. But then you would contact the patient, and then they may make an appointment with you. You might contact them, and they might book through a booking service or something like that you've got offered. They will then schedule that appointment with you, and they might complete their online information to give you all that new patient information to save you doing that when they come into the practice. They complete that online, and that then pre-fills into your clinical software. Some of those things may be happening for you, some of them may not, and that's what we'll look at. And when we come out, we'll actually give you this as an editable PDF, so you can actually jump in and say, okay, this is what we do now, this is what we could do in the future. So it's a work in progress. It's not you have to have this. Let's just work with you to see what's achievable and where we want to go to from there. Kate, I'll get you to jump down to the next slide. And so this is where the other one joins. You can see we've got the patient self-referring here. So they might contact your practice. Again, same thing. You might provide them with an access to an online booking app so they can book their appointment with you. They might complete that new patient information again as part of that app. Some of them do that. Others have a different, they might send out a link. You might send out a link and they complete things. And it pre-fills that information into your clinical system, which saves that time. And it also reduces that potential for, data entry and things like that. Patient would then, when they book that appointment, they'll get some communication out to them to say, yep, your appointment's confirmed. Might be a reminder go out. It might be, here's a digital calendar download so that you can put that into your calendar so you get the reminder the day before, the day of the appointment. And also you might send out an SMS or an email to say, hey, don't forget your appointment's tomorrow. They would then attend that appointment with you. It might be in person, it might be via telehealth, depending again on your practice and or where the patient's located. You might have looked at their My Health record to see, is there applicable bloods there? Is there some dispense information from their medicines? Confirming what medicines, because a My Health record can be a really great source of truth. We've probably all experienced that occasion where you ask the patient, you know, what medication are you taking? Oh, well, it's the little green pill and it's about that big, and I take it twice a day. That My Health record can be that's that source of truth. You can see what's been prescribed. You can see what's been dispensed. You might, again, respond back to the carer, as part of that care plan, back to the referrer to give them some information on that midpoint update in the care episode. And then you might take those next steps as required. So you might be, you know, scheduling a future appointment. If it's a one-off engagement, it might be you upload, if you've got access via conformance software, upload an event summary to the My Health record. But if not, you might share information again back to the referrer, back to the specialist, back to the other allied health professional to let them know what's happened with that journey as well for that patient. So you're sharing that information, sharing that securely. And then, of course, yeah, we've got the finalised, so we might upload an event summary to the My Health record, send that end of episode care information back to the referrer. And again, yeah, that information going up into the My Health record. As I mentioned, it's an end-to-end process. It's what we would love to see. Some of it will be achievable, some of it may not, and some of it's going to depend on what you've got available, what are the tools that you've got available at the time, and how we can integrate that into your practice. And that's it for me on that one, Kate.
It's a good horizon goal to work towards. However, we will work on making sure you feel comfortable. I'm going to come back to that comfortability. What's the right vibe, the right speed, what's achievable? We want you to be successful in this program of work. I love this though. I really like the idea of having a visual that you can put up as a bit of a guiding light in your organisation as well to help you achieve some step throughs as we move through this program. Thanks, Pete. Did anyone have any questions for Pete before we finalise with next steps? Cool. Look, we really appreciate your time tonight, guys. It's been a really lovely opportunity to see you in person before we arrive and start to build that rapport and connection. As I mentioned before, we'll finalise the LMS for partnership and send you out those links and support task cards to get you up and running at the end of this week. Throughout October and early November or late October, as it will be. We'd love you to finish or start moving through those startup activities that I walked you through. If you need a hand, let us know. One of the questions that came out of the self-service was, what's the anticipated time frame it's going to take me to finish those activities? What we recommend is that they should be completed in the first 4 weeks. We'll be seeing you in a couple of weeks. We anticipate that you will have started those by the time we see you. Jodie's taking photos of us. I love that, Jodie. That's for a reminder tomorrow, isn't it? Yeah, absolutely. I thought you just wanted to see my face tomorrow. It's all good. But when we come and see you at your workshop, we're really looking forward to that road trip, and that will really allow us to support you through stage 1 finalisation and into stage 2. As I mentioned, we'll book your virtual hour-and-a-half tailored improvement plan meeting during that workshop, so there's nothing else for you to do. We'll agree on those activities. You might want to change some of the ones that are on the recommendation. You might want to add some depending on where you are in your digital journey by the time we come back. And look, we really will provide that support and direct access throughout the project so that we can gain the best advantage for yourselves, Allied Health and PHN out of this opportunity. So thank you very much. Any last closing comments from anybody? I'm mindful that we have a beautiful 4 minutes left.
Just an evaluation, Kate, 2 slides down, if everyone's got a mobile phone and they don't mind scanning a QR code.
Done.
Yes, and there's just a couple of questions. If you don't mind filling it in, this is really useful data for us. So when we put projects together, we have evidence to provide feedback of what clinicians think. And it's also an opportunity for you to tell us what education that you would like us to seek experts to deliver topics to you as well. So that would be great. If anyone has problems with the QR code, I can email a link. So just let me know. I'll send you some follow-up comms after this. Or you should all have my email anyway.
Beautiful. Maz, anything? Pete, anything in closing?
Nothing from me, no. I'd like to thank everyone for their time and looking forward to meeting you all in person.
Absolutely, and I'll echo that. It was lovely to see you all here tonight, and wish you all the best. And reach out, if you need some support.
We might have to practice some Dutch.
Yeah, Champagne and Dutch heritage. I was just like, oh, this is getting interesting.
Amazing. Thank you, everybody. We'll see you in the coming weeks. Look forward to working with you all.
Look forward to seeing you. Thank you.
See everyone.
Bye.
Thanks, team.
Bye.
Bye, everyone.
Thank you.
Thanks, Jodie. See you soon.